Right, welcome to today's episode of Molecules to Medicine. For those of you just joining the podcast, we are AI Jules, and we specialize in helping healthcare and life science companies scale their business and revenue and explore how AI is reshaping industries and accelerating innovation. So if you'd like to learn more how to take your healthcare or life science business to the next level, then make sure you stick around. And if you're interested in a free growth consultation, just drop the word growth in the DMs and we'll get back to you. I'm your host, Hardeep, and we have a very exciting guest for you today. We have Doug Frederick, the CEO of HealthCues. So welcome, Doug.
Welcome. I appreciate it. Thanks, Hardeep. Glad to be on.
No problem. And where are you joining us from today?
I'm in Orange County, California.
Beautiful, very nice.
Yes.
And I assume it's nice and sunny there as well.
It still is, thank goodness.
Yes. Well, I'm in the UK. We're moving into winter now. As you can imagine, it's grey and miserable out there. But right, so Doug, tell us a bit about your background and the journey that led you to HealthCues and a pivotal moment in your experience that shaped your career.
Yeah, so it was about 9 years ago I saw a similar plan to what we market now, what we put together. And at that time, it's not gotten better. Major Medical was just not in a good spot, just coming off of getting Obamacare approved as far as trying to provide affordable and provide everyone with major medical. And what we saw was we spent $4.5 trillion in 2024 on healthcare in the US, 80% is preventable. And so we went a different route where we put together a program that really tries to get people to be more preventable about their health, think more about their health, and found out some different financial ways to do this, to make this affordable for everyone. And it's been a fun journey just to realize how, I don't want to say how easy because nothing's real easy in life, but how using common sense you can be healthier, more preventable, a long-term chronic disease. So it's been quite a journey. I saw this program. I was buying notes from banks and hedge funds at the time on properties. And I saw this. I was like, if this is real, I'm changing today. Made the change. Unfortunately, it wasn't quite real. It took us about 18 months to even get the product up and running. But it's turned into really successful. We helped a lot of businesses, helped a lot of people become more preventative and financially become more successful in life. So it's been a fun journey.
Okay. And have you seen your role sort of expectations change in the past decade to move into that field?
Well, look, I really think you what they say by 2033, 65% in the US anyway are going to be considered obese. So it's obviously we're moving into the direction of being more unhealthy, which doesn't make sense. With all the technology, everything, you would think it would be the opposite. I think they said in the 70s, the average man weighed 160, the average woman weighed 140, and now you're almost 25 pounds heavier for each person. So the average man's right around 185, average woman's around 160. It just doesn't make sense that that's the direction we're moving in. There's lots of things we could be doing to make this better. It's just kind of this passion I have for it's common sense, getting common sense to people to get them to be more preventable.
Brilliant. Yeah. I mean, with the diseases that equals to as well, like diabetes and heart disease as well, it's, very, very prevalent. Like they say, sometimes the biggest killer is the chair, that inactiveness and obviously diet as well. And so it's good to see that, you're looking at ways that people can improve their health and, change their and try not to depend on too many medications as well. I mean, we're seeing a lot of the fat drug that's come out that a lot of people are taking up now. And as a quick fix, I don't agree with quick fixes personally. I don't think it works, but very, very interesting. And so what emerging trends or technologies are you most excited about in the area of work?
I don't know if it's super emerging, but really the teleservices that they offer out there. Before the pandemic, I would be surprised if it was 3% utilization in all the teleservices, telemedicine, teletherapy. I would say it's probably up to 30% now, which doesn't seem like a lot, but to go from 3 to 30% in 5 years. And really we found what the teleservices, which I love, what I found with them is it makes it easier for someone to reach out. So if I have to go to work tomorrow, I don't feel good. The first thing I think well, what if I take a day off? What's that mean to me financially? I have to drive to the doctor. I have to wait probably an hour in the waiting room, an hour in his office, and 4 minutes later, I go get a prescription. So I think the teleservices is something we really like. And how do you make this really easy to access? Anything that can easily get access for people to talk to someone where they don't have to jump through hoops, I think is really important. I think that's going to go a long way. You talk to a lot of the doctors out there now, and there's a protocol they have to follow. And is that protocol the best outcome for the employee? It's probably the best outcome for the hospital or the doctor. And nothing against the doctor or hospital, but
Yeah.
there's just so many rules, regulations everyone has to follow now. Sometimes the question is this the best for everyone?
And how easy is it to see a GP, a doctor, a physician?
With our program and a lot of other programs, there's two different ways. If you want to go in person, you can go that day. You can be seen by a doctor. You have to go to a clinic. It's not going to be probably necessarily the doctor that's in your network for your major medical.
Yeah.
But you would be able to get into a clinic with 10, 15 minutes away from you that day. And if you wanted to go online, within 24 hours, you'd be able to speak to a board certified doctor. This is above and beyond telemedicine. You can talk about upcoming visits, labs, anything like that. And if you like that doctor, you can continue working with them as often as you want. There's no copay, doctor pay. And it's really almost could become a secondary doctor, or it could become your primary doctor. So we make it really easy to get in to see someone you need to see.
Okay, great. And in terms of biggest opportunities for innovation or impact in healthcare, where do you see that right now? Maybe outside of the teleservices, or is that the
Well,
main?
look, it's really AI. Everyone needs to really jump on this bandwagon. When AI came to me, I'm not the most technologically adept person, and it came to me. And the first AI that I saw, it was really about sales. We can increase your sales. We can get more patients. We can get more clients. And I don't think AI is there. I don't think it's any better than any of the services when it comes to sales. So I kept asking, going to AI, different seminars. And there is a lot of ways to use AI to really function for the employee, the employer, as far as like, how do we get easier access? Compare, like, this is what I have. How do I compare that? I just think AI is the wave of the future for everyone, and everyone needs to embrace it and try to figure out how it's going to be helpful for them.
Yeah, for sure. Yeah. So it looks like, have you tried AI in your sales outreach as well to see if that helps?
We have, and look, I think AI could work. Our program we offer there's several moving parts. We're not selling, well, major medical has a lot of moving parts, but we're not selling life insurance where it's very easy to understand. So it makes it a little more difficult on the sales side for AI to work. I was in a seminar the other day. I was talking to people that we work with, and I may have been the only person. Said there was probably a room of 40 people. They said, who in this room does not use AI on a daily basis? Embarrassed to say, I was the only one that did not raise my hand that says that they're using AI every day. And everyone in my company started laughing at me, like, how do you not use AI every day? They're like, don't you use AI for emails? Don't you use it? I was like, I guess I'm not in this century yet, but it's our people use it every day for sure.
Yeah, and it is a very helpful tool at the moment, and as the days go on, it's getting more and more, and people are understanding its broader uses of how it can help.
Right.
And there's a lot of talk from government level as well. I know that in the UK, I think there was an announcement that there's going to be a collaboration with the US and the UK to build the infrastructure in the UK to be able to to house a lot of the requirements to build on the AI, especially in medicine as well. They're looking, to really push that, the diagnostic side of it and where it can help. So it's going to be very exciting, I think. But a lot of people are also worried about it too, especially when it comes to their work and the jobs and, how accurate it can be. So it's definitely a very, very interesting time for sure. So, yeah. So that being said, so tell me about HealthCues and so what is it exactly that you do and who do you do it for?
Yeah, so we provide preventative healthcare to employers and employees. And really what it is, it's an innovative way to get preventative healthcare in front of employees. On average, our program is going to give an employee a $70 to $100 pay increase by being part of the program. they get preventative healthcare for the whole household. So they get all the teleservices, DNA screening, biometric screening, health coaching, no copay, doctor pays. And then the employee gets, if they go in the hospital, use ER, ambulance, they get extra money to try to help out with deductibles and coinsurance. So what we're trying to do, once again, is get people to take control of their own health, understand what they should be eating, shouldn't be eating. If I'm going to exercise, this is a better way for me to exercise. So we're providing all of that. So the employee does have an incentive to be part of the program. It's very simple to participate. It's as simple as getting monthly newsletters. So it's, the biggest part with people trying to be more preventative or using wellness programs is you get to a point, you get to about the fourth month, you feel like you have a part-time job just trying to keep up with what you need to do to get a lower health insurance premium and so forth. We make it very simple because the idea of our program, you're not getting healthy, you're not getting preventative in 2 months. It's a 12, 18-month journey to get to that point to turn it into a lifestyle.
Yeah.
And what I really like about the program, the employer saves money on payroll taxes. So at the end of the day, there's very few programs out there that you're rowing the boat in the same direction where the employer wants every employee to be on it because they get a financial incentive. Every employee should be on it because they're getting extra money in their paycheck. And for us, if we can engage employees, and I know this sounds a lot about money, but if we can't engage employees and they don't want to stay on the program, we don't get paid either. So for once, all three people, everyone has an incentive for the employee to be more preventative about their healthcare. And that's what I really like. If I go to an employer and they share the cost of major medical, the employer probably sometimes is like, hey, geez, I hope Doug has insurance through his spouse. That saves me money every month.
Yeah.
So with this one, the employer looks at this like, yeah, we want the employee to be more preventative.
Yeah.
That's how the program works. We do really well in all aspects. Blue collar, we do really well because we're really providing services that some of the blue collar crowd would not be spending money on. So they're getting these services plus getting paid to have access to them.
So does this work hand in hand with, say, occupational health
Yes,
companies? Yes. So
absolutely.
yeah. And do you target sort of manufacturers where I know Occ Health is a big thing, but especially manual work as well?
We do. Like I said, this works for everyone. We do really well in QSR franchise space, McDonald's, Burger King, franchise, PEO, assisted living, hospitality, fine dining, which is more of that crowd where it's people. A lot of time we use this for recruitment and retention. So we're going out. It's not, we don't care about you only today. We care about long term, and it does help. People like to know that their employers care about them and want them to be healthier. And that's how we market the program. And we try to get the employer, although they all are, more into that, like, be healthy. You can't come, if you're not healthy, it's hard for you to come to work and be a part of a healthy environment.
So would you say there's two arms to it? Is there an anatomy arm, the physicality where you can help, as well as disease prevention as well? Are they two separately, or is it something that's combined together as a package?
It's definitely combined together. Really, the whole idea is, like I said, we spend $4.5 trillion on healthcare, 80% is preventable. And even if we could affect 1% of the population, it's going to be a home run for the government. It's going to be a home run for employers, employees, and so forth. It's really, the main thing is, how do you engage people? How do you engage people in 2025, 2012, 2026 almost? That's the real key, is for us to be ultra successful. We have about a 35% participation rate, engagement rate in our program. Industry standards about 9 to 10. 35% of the employees outside getting monthly digital health coaching, they're using one of our services. And a lot of people like 35 is not that high. If we got to 45, I'd be ecstatic. We have people come in and say, we can get you to 90% utilization. It's like, there's nothing in the world that probably has 90% utilization, except for if there was free money at the ATM, maybe we'd get 90% utilization there. But so we pride ourselves in making sure the employees know what they have access to, putting programs in that are going to engage them. That's, how do you gamify it? How do you engage people? How do you get people to be reactive to what you're offering?
Yeah. So, I mean, what would you say is the main problem that HealthCues solves? Is it that employee wellness, that an employer can feel comfortable with, that 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 their business is going to function more streamlined and reduce those sick days? Would that be, say, the main problem you're solving there?
That's our goal. That is our goal to, what we're trying to happier, healthier employees, fewer sick days, more profitability for the company. It's not only profitability, but that employees having fewer sick days, fewer days off, and hopefully not going over the days that they have off. So
Yeah.
look, finance is a lot of emotional, mental help as well. When like, hey, I'm going to be healthier. So that is what we're trying to do. We're really looking at the chronic. We're looking long term. How can we keep people from going that direction? I believe it's 60% of the people over age 50 have at least one
Mm.
chronic disease, if not two. And we're trying to lower that.
Yeah, so I mean, everybody wins, really, don't they? There,
They do.
the individual, of course. I think health awareness, I think, is a bit bigger. It's a bit better now in recent years with social media. I think you get a lot of influencers, just normal, regular people, that are really highlighting some of the issues, in supermarkets with what people are eating. Because I think a lot of the problems come down to lifestyle.
Correct.
Having this sort of coaching, from an employer, I think would really, really bolster that positioning for sure. So yeah, with that being said, can you share any real examples of any customers that have used HealthCues that have achieved meaningful results?
Yeah, we have. We've had some of the employees have actually found out the path they were on going to chronic disease. Our goal, keep in mind, our goal is
Uh-huh.
to get an employee to call in, an individual to call in, talk to a health coach. What are some issues? What's going on? Then we
Uh-huh.
try to get them to take a biometric screening. There's no cost. Everything's sent to the house, 15 minutes, you're done. Then we try to get them to do DNA screening, get back on, talk to a health coach. And really what you're trying to find out is like, what do I have predisposition to possibly? What can I do to do a better job of not, maybe I have predisposition to diabetes. Okay, well, what's going to lead me into a path so I don't end up there? And also with the DNA, if I want to work out, if I want to eat, and when I say diet, I don't mean go on a diet. It's what type of food for my body is better. Mine was fat free. I didn't even know that was a real thing anymore. I mean, that's from the past. But
Uh-huh.
if I want to eat healthier, how my body absorbs food, a fat free diet is better for me. Some
Yeah.
people could be the paleo, if that's good for you or not.
Uh-huh.
So that's what we're trying to do, get them going the direction of like, this is what your body should be telling you. And this is how
Right.
if you're going to work out, considering your age and everything. So we're trying to do that. I mean, that's really what we're trying to do is get people going in the right direction.
Yeah, that's interesting that you're using technology there as well with some DNA testing to see how their health, well, the current state of their health and what they need to do to change that. There's always advances in that side of it as well. And I used to work with a company that was developing blood glucose monitors.
Yeah,
And they've sort of white labeled it. Another company's white labeled it now to, instead of treating diabetes, to do exactly what you're saying there,
right.
to see how their diet changes and how their blood glucose changes based on what they're eating. And the algorithms there give you some tailored solutions or ideas of what you should change differently. So that's interesting. But also, I was also working on a study where the NHS are looking to trial out a new blood test where
Mhm.
a blood test for over 50s can target 50 different cancers and catch these really, really early, super early. In this, I think it's an American company actually, um, who we're trialing this out in the UK now. So if you looks like you're on the forefront of technology there, and you're looking to keep that going, which will really help the prognosis of a lot of your people's employees. So that's
Right.
great to hear. That's definitely great to hear. And so what makes HealthCues different from other companies trying to solve the same problem?
Difference. I feel there's a difference between having a company and actually trying to solve a problem. Because a lot of people
Right.
have companies. The company's put together to, no one starts a company to lose money,
Yeah.
obviously. And really, I think for us, it's the engagement. We are
Mhm.
consistently looking in. If we can't engage someone, what's really the difference of having our program and not having our program outside you getting more money in your paycheck?
Yeah.
So we put a lot of time and effort. Every month, we're running we run contests to get people to download the app. If they don't download the app, it's hard for them to access. Not hard, they still can, but it's less doubtful they're going to access the different services they have access to. So we run
Yeah.
contests. We run a monthly Do You Know campaign. Do you know you have access to free biometric screening for your whole household? So
Yeah.
we're constantly doing this. We're going back to, we go back to the owners of the company and go through everything and say, look, here's your utilization, all these. What do we think we can do better? We go back to companies and say, look, we can't talk about any individual person, but we can go back to a company and say, we've had 34 cases of someone that have back issues. We really
Yeah.
need to look into this. Is this a work related event? What could we do to make it better? Not always, but we're always trying to go to employers and say, this is something we could do. Yes, it is getting your employees healthier. It may cost a little bit of money, but the long-term outcome, not just for the health, but for the company, is going to end up being a lot better than just avoiding talking about it today. So we spend a lot of time trying to engage people. Some people think too much time. Some of my employees think that as well. We're always looking, how do we how do you think about this? I do this anyway, and you're going to say, yeah, you probably have ADD really bad. I'll think, hey, I need to send Hardeep an email. I look at my email, I get sucked into the first 10 in my inbox. Do I need to answer this, and this? There's probably a 75% chance I'm leaving my email without sending you the email because I got distracted doing
Yeah.
other things. I think that's the general public now. And so what we're trying to do is if we can get an employee to come on the app, how can we distract them? They may have went for one specific thing, maybe to play a game. How can we immediately distract them to get them to do something healthy for themselves?
Yeah.
So, once again, how do you engage them? Is it gamifying? I'm not sure. I think even you and I, if we went to an app and there's some type of gamification, it's not just the 20s. So that's what we're trying to figure out. How do you get people to come back to the app and take it serious?
Okay, great. Great. Yeah. That's very different, isn't it? And how do you see HealthCues evolving over the next few years?
I believe HealthCues, these types of plans will eventually be put into the major medical plans to where major medical is, I can only tell you my feeling. Major medical is when something happens to you, when you need to see a doctor. 7 out of 10 times, probably go to a doctor. We probably know why we're going. And it's not about, there's preventative health care in major medical. I don't want to sound like that, but there needs to be someone inside that major medical plan really pushing the preventative health care, not just saying, hey, here's this thing. You do have access to this because major medical is difficult enough to understand today anyway. What doctor can I go to? Is my copay paid and everything? So that's the next step is really this is going to be a major plan in a majority of the white collar companies as well, let alone not just blue collar. And it's going to be a push to be more preventative instead of, hey, by the way, you have this option.
Okay. And what would be the best way to explore that and to really make a stamp there?
It's really more talking to the major medical carriers, which I think a lot of groups in our plan aren't doing. The major medical players out there right now, we're not a competitor, but
Yeah.
many of the services we offer are already in the major medical plan. At the end of the day, we can pull ours out and use theirs. So it's not like we're taking away a service from them. So I think it's just a matter of time before these major medical plans really see that. I don't know if I want to say the value of the program, because the value is there, but how do we implement this? How do we put it in here, and how do we market this to the employers we're working with currently?
Yeah, for sure. Yeah. That sounds interesting. That does, to get major medical on board to use this, because I guess it's not something that they're currently doing, and probably thinking, does this cannibalize what we're already doing?
Correct.
I guess is their biggest worry, isn't it? But
It is. We do work with a few hospitals, and
right.
what we've told the hospitals, you have telemed, we'll use your telemed. You have virtual primary care, we'll use your doctors. This isn't, and we try to tailor our program. How do we push the employees back into their system? Not back into their system, but like to get to use their doctors. And I think the way we market it is a little different. Maybe it's a little funner, sounds a little
Yeah.
more exciting. And how do we do that so that we can keep putting people back into that hospital system? So like you said, they don't feel like, is this competitive? Are we losing market share? Are the employees that work here, the people who normally come here, now they're using someone else's teleservices? So we try
Yeah.
to work with them. Believe it or not, there are a lot of school districts that are implementing health coaches that have on-site in the US that have on-site health coaches, have on-site trainers. So Some of the schools are already going this direction. I think with a program like ours, where this is all we do. We don't do major medical. We don't go to someone and tell someone this is major medical. This is all preventive healthcare. We're trying to help chronic
Mhm.
disease. We're not trying to tell someone, well, we're the doctor. We're going to tell you exactly what to do. We're going to try to tell you how to be preventative. We're not the one you should come talk to if something's broken.
Yeah.
That's the doctors.
Come talk to us if you don't want it to break.
Right. Exactly.
Great. And what stage is HealthCues at right now, and what does growth look like over the next 12 months?
We've been doing well. I started HealthCues 6 years ago, almost 6 years ago to date, and we've come close to doubling every year. We should be doing better than that. There's less than probably a 1% penetration in the U.S. business market for these types of programs. There's a big runway, and I think it's more, who are those partnerships you're going to create over the next year, 2 years, that's really going to decide your trajectory to what way your company is going to go.
Okay. So partnerships, is that with different employers, sorry. Yeah.
Correct. Different employers, even if we try to work with government agencies, states, there's sometimes slower adapters to these types of programs. So the quicker we can get in there, hospitals, I think that's where we're really going to do much better.
Have you considered universities and educational facilities?
Yes. What we've ran into, this is interesting. We do have a niche now, not exactly what you're talking about, but with athletic departments at universities, where we go in and we tell them, look, Joe has 1,000 employees. He's normally giving you $1,000 a year, $100,000 a year. Have Joe come on our program. Joe's going to save $700,000 a year. He's going to love you. He's even going to love the university more now. So maybe you get 200,000. It's not about out of pocket for him or her. So we've somewhat penetrated that with the universities. What we found out, it's almost like a 3-year game. So a lot of times I'll go to the university. I'll be like, hey, this is a benefit. I went to local university, 31,000 employees. And I was like, look, this program, let alone, is going to save you $18 million a year.
Right.
And a lot of times, this is 2024, at the end of 2024, they're like, this could be something we look at in 2027. I'm like, oh, okay. So 18 million for the next 3 years is just something not that big of a deal. And that's what we run into a lot of times, because they have their procedures, they have their processes. A big group we talked to, a casino group, got to the end of the road and they're like, hey, did anyone tell you we just did a 3-year RFP? So we can only do benefits through this company for the next 3 years. And I'm like, but they don't offer our program. Well, it doesn't matter. Come back in 3 years and we'll talk. And it's for them, once again, 25 million in savings plus preventive healthcare, which they needed it.
Yeah.
So that's the hard part. And that's what I'm saying. It's another year, 2 years before we get into some of these major medical plans, or this becomes something you can't not have. I don't think that's really a word or a phrase, but I used it.
Yeah. And what growth channels are you currently using at the moment, or what's working best for you?
Really, for us, it's word of mouth. We've come entrenched really we have about 6, 7 different niches that we do really well at. We're pretty well known in all of those. So a lot of it's word of mouth. We do some social media. The social media really for us, it doesn't sell. It's almost more like they're a relevant company. They keep seeing the name. So the social media doesn't do a lot of sales for us. It is more right now referrals. We're trying to get more into associations. That way we can, instead of getting in front of one person at a time, maybe we're getting in front of 20, 50, 100. So that's really the next step, is how do we get in front of more people faster? And then how do you scale how quickly you can bring clients on, and the volume of clients to bring on.
So would you say that's raising awareness, more awareness in the market?
Absolutely. It's definitely raising awareness. I would say 4 years ago, there were 5 companies doing this. I could name every one of them. Probably every other week, there's a new company popping up, doing a form of this, a fashion of this. There's got to be over 20 now. And 3 years ago, 1 out of 10 business owners have heard of a program like this. I'd say now it's more like 5 to 6 have heard of it. Not necessarily doing it, but have at least heard of the program. So like you're saying, the awareness is there now.
There's some chatter about it in the industry, but not much uptake by the sounds of it as of yet.
No, not as of yet. A lot of the people look at this and 9 out of 10 times, this sounds too good to be true. How can we save money, no out of pocket? How does the employee save money, no out of pocket? Why does the federal government want to do this? Well, Congress and the government look at this. They're paying out dollars today to save hundreds later. And that's how Congress and the government looks at it. And that's the hurdle we have to overcome. New, even though
Mm.
it's been around for 8 years, new. This is too good to be true. How come I haven't heard of it? And a lot of times you haven't heard of it because your benefit broker doesn't have a program like this or doesn't offer it. And your benefit broker, love them, but your benefit broker doesn't want us in there offering benefits to their employer. And I understand that.
Have you considered looking at what literature is out there that you could use to bolster your claims? Really, look at any clinical evidence. Refer
Well,
to studies that have been done that can
for
really push
us,
this message.
no, that's a great point. For us, until we can really penetrate, and I don't like to go between white collar, blue collar, but until we can really penetrate that white collar, it is difficult when we're working in the franchise staffing PEO space, high turnover. We don't necessarily have access to major medical records. Think about it, the local franchise, they may offer their 30 employees at one location major medical, and they have two that take it. Two or three possibly that take it. So it's kind of hard to really back into. There's an ROI obviously through the payroll tax savings, but to back into the savings until we get enough data, I would say over the next year to 2 years with more white collar where we have access to their medical data. Whether I say access, but we could see, okay, we're more claims filed, we're less claims filed. Until we can get that where you have probably less of a turnover, it's going to be
Mm.
hard to quantify data.
Yeah. So the angle I'm thinking of it is because my background is actually drug development, so
Mm-hmm.
manufacturing and proving efficacy of drugs. And essentially, what it sounds like to me is you kind of need to maybe do the same thing to get that partnership on board. And the solutions you're providing has been in the industry for decades, actually.
It has.
Healthy living and
Right.
you eat, what you do, exercise, and all that. And there is an abundance of primary resources out there that
Right.
you like yourself could actually reference to and use that to make claims. And, to say, well, look, X doctor did this in X year, proved this.
Right.
This is exactly what we're providing, and here's the proof. That it's going to work. Especially to an employer as well. Your employees do this, they're going to not have this.
Correct.
Therefore, that's going to equal less time off for X amount of employees. So just something I'm just thinking that could probably
No, I love it. Yeah,
bolster your positioning. And it's definitely that's something that with my background I can definitely look into it as well for you. Should you like?
for sure.
Heavily I've been involved in, and the great thing, you don't even really have to do any clinical research, because it's just literature reviews, and you can just package that together into a document, and that is regulatory and legally binding as well. So that would really bolster your claims for sure. So that's interesting. I can see how you could actually grow that.
Well, Hardeep, I would love to speak offline about some of your different thoughts on this
We
and
will be,
figure out.
yes,
Yes,
definitely. Just to move on though, yeah. So I guess that's a bottleneck for you, because the next question was what bottlenecks are you experiencing with your pipeline and outreach? But I guess one of them would be actually convincing people by the sounds
correct.
of it. This is how it works. So that sounds really interesting to me, and we can definitely follow that up with another call and to
Yeah.
discuss that. Any other bottlenecks that you could think of? We mentioned partnerships and awareness, and
You really, the bottleneck is getting over too good to be true.
yeah, yeah,
And that's why we try to stay in a niche until we, like right now we're moving into manufacturing. It took a while. And the reason being is if I go to Carl's Jr., McDonald's, Subway, we have all of them. In other
yeah.
words, we have franchise owners, so they can call
Yeah.
them up. Is this as easy as Doug said? Do your employees like it? Do you see the savings? So for them, that's why word of mouth works.
Yeah.
But you get into the manufacturing space, they're like, well, I don't care to hear about McDonald's or that assisted living. We're not McDonald's. We're not assisted living. Our employees are different. I want to see how the manufacturing crowd loves it. So you kind of, I don't want to say slowly, but you have to move from one to the next to,
Yeah.
hopefully in a year and a half, you have 15 niches.
Sure. Sure. Yeah. Okay. Great. Uh, so what are your top priorities then for the next or this quarter? Well, the quarter's nearly ending. Maybe next quarter.
Well, really next quarter, we're looking to partner, major partnership, hopefully have that finished in the next 3 to 4 months. That's really going to propel us into the next evolution of our business. Then really, like I said, more focusing on how do we get in front of more people at once. We do a great job of getting one by one by one by one, but how do we get in front of more people at once? Like you said, to get the awareness out there, the understanding of how the program works and how accepted these are today
Uh-huh.
uh, in the business community. So that's really our goal, is to finish our partnership, figure out who are maybe some other people we need to be partnering with, as well as how do we get this out there quicker to more people. And that's
Okay.
really the goal for the
Yeah.
next 12 months.
Definitely. Definitely. And where can people listen to this? Learn more about HealthCues or get in touch with your team.
Look, our website, healthcues.com. Happy to put my email, my phone number on here as well. We have a whole team. I call them the A team. They're amazing. I wouldn't be anywhere without them. They do the heavy lifting, and I try to oversee everything and make sure everyone's successful and we're successful for our clients and employers.
Thank you for your time today, and thank you
Pleasure.
for joining this podcast. And very, very interesting. And our listeners will be sure to enjoy it and got your information should they want to more information. So thank you very
Sounds
much.
good. Thank you.